to our channel Learning Together. Today we are going to discuss about the possible Loksewa nursing examination question, and we will discuss the answer also and the reason for the answer. Now let's go to the question number 1. Question number 1 here. What is the first step of nursing process? What do you think the answer? The answer is very simple. That is assessment. The first step of nursing process is assessment. In this step, the nurse collects subjective and objective information about the patient. So that is the answer here. Now let's discuss about the question number 2. What is the most effective method to prevent hospital-acquired infection? The answer here is hand hygiene. Hand hygiene is the most important and effective method for preventing the spread of healthcare associated infection, because microorganisms can easily spread from one person to another person through the hand of a healthcare worker, and proper hand washing hygiene remove and reduce the microorganism, and it is the most important for the infection prevention measures. Now let's discuss about the question number 3. The normal adult pulse rate is, the answer here is 60 to 100. The healthy resting adult, the normal pulse is generally 60 to 100 beat per minute. A pulse below this range may be called bradycardia, and above this range called tachycardia, depending on the clinical situation. The normal resting pulse rate of an adult is generally 60 to 100 beats per minute. Now let's discuss about the question number 4. The normal adult respiratory rate is 12 to 20 per minute. A healthy adult normally requires about 12 to 20 times per minute at a rest. Respiratory rate is an important vital sign. The normal respiratory rate of an adult is approximately 12 to 20 breath per minute. Now let's discuss about the question number 5. What is the normal GCS score? GCS denote here glass glaucoma scale, and the normal score is 15. The GCS assists consciousness using 3 components: eye opening, which contain 4 points, verbal response, which contain 5 points, and motor response, which contains 6 points. The total score or maximum score is 15. So the maximum and the normal GCS score is 15 out of 15. Now let's discuss about the question number 6. Which position is commonly used for patient with breathing difficulty? Which is the answer, do you think? The answer is the Fowler's position. Fowler's position is commonly used for patient with respiratory difficulty because elevation of the upper body is important, and it helps in improving the lungs expansion. So the patient with the breathing difficulty is usually sit in the Fowler's position. Now question number 7. Which pulse is commonly assessed in an adult? The answer is very simple. The radial pulse. The radial pulse is located at the wrist and easily accessible. Therefore, it is commonly used to assess the pulse of the conscious patient. Now, question number 8. Question number 8. The normal body temperature is approximately, that is 37 degrees Celsius. The normal body temperature varies depending on the person, measuring site and the time of the day. But 37 degrees Celsius is traditionally used as a approximate reference value. Now let's discuss about the question number 9. The the nursing process consists of how many steps? The nursing process consists of 5 steps, that is assessment, diagnosis, planning, implementation and evaluation. Now let's discuss about the question number 10. Which is the which is not a component of GCS score? The answer is D. Pupillary reaction. GCS score consists of eye, verbal, and motor response or skills. Pupillary response is not included in the GCS score. Now let's discuss about the 11 number. What is the functional unit of the kidney? The answer here is nephron. Nephron is the structural and functional unit of the kidney and responsible for the urine formation. The nephron is the microscopic structural and functional unit of the kidney, and it also helps in the formation of the filtration, reabsorption and secretion to help for urine formation. Now question number 12. What is the functional unit of the nervous system? The answer is very much simple. Neuron. Neuron is the basic structural and functional unit of the nervous system, which help in the receive and transmit nerve impulses from one part to another part. Now let's discuss about the question number 13. Which is the largest organ of the human body? The skin is the largest organ of the human body. It is the its function involve protection, sensation, and temperature regulation. Now let's discuss about the 14 question number. What is the or which is the largest internal organ in the body? The largest internal organ is the liver. Liver is the largest internal solid organ. It performs many functions including metabolism, deoxification, bile production and storation of the nutrient. So now let's discuss about the question number 15. The normal adult heart rate is, that is 60 to 100. The normal resting heart rate for most adult is 60 to 100 beat per minute. Now let's discuss about the question number 16. The main function of RBS or red blood cell is to transport is to transport oxygen from lungs to the body tissue through hemoglobin. Now, let's discuss question number 17. The hormone that lower blood glucose is, the answer is insulin. Insulin is produced by the beta cell of the pancreas. It lower blood glucose level by helping glucose entering in the cell and by promoting storage of glucose, and it also help to reduce the blood glucose level. Now question number 18. The basic unit of life is cell. All living organisms are made up of cell. Cell are the basic structural and the fundamental or functional unit of the life. Now let's discuss about the question number 19. Gas exchange in lungs occur mainly in the, which is the site of the gas exchange in the lungs. The question says about that, and everybody know that is the alveoli. It is the tiny air sac in the lungs. Oxygen passes from alveoli into the blood, while carrying carbon dioxide passes from blood into the alveoli. I am going to repeat it this once more. Gas exchange take place mainly in the alveoli, where oxygen and carbon dioxide move between the air and the blood. Now let's discuss about the 10 number. The normal number of chromosome in the human somatic cell is, that is 46. 23 pair and 46 chromosome. The mass human body cell contain 46 chromosome arranged in 23 pair. Gametes contain 23 chromosome. So we should write here the 46 chromosome. When it is writing here the 23 pair, then the answer is 23 pair, but here is no pair mentioned, only here is the number, and number is 46. Now let's discuss about the question number 21. Question number 21. The most common system of myocardial infarction is, that is answer A, chest pain. Myocardial infarction occur when the part of the heart muscle doesn't receive adequate blood supply. A common presentation is chest discomfort or pressure. Although symptom can vary, chest discomfort or pressure is the common symptom of myocardial infarction. Although some patient may have also the atypical presentation. Now let's discuss about the question number 22. The most common symptom of hypoglycemia is, answer is A, sweat and tremor. When the blood glucose level fall too low, the symptomatic nervous system is activated. Sympathetic nervous system is activated. This can cause sweating, tremor, palpitation and hunger. Severe hypoglycemia can cause confusion and loss of consciousness. So the sweating and the tremor is the most common symptom of the hypoglycemia. Now let's discuss about the question number 23. Question number 23. The classic sign of left sided heart failure is, The answer is pulmonary congestion. When the left ventricle cannot pump effectively blood back blood back up into the pulmonary circulation. This can cause pulmonary congestion, dyspnea, and sometimes pulmonary edema. Left-sided, or we can also say the left-sided heart failure commonly cause pulmonary congestion because blood back up into the lungs. Now let's discuss about the question number 24. A common symptom of diabetes mellitus is polyuria. Here we should think about the classic symptom: polyuria, polydipsia, polyphagia, and this is the common symptom of the diabetes mellitus. High blood glucose can cause glucose to appear in the urine. Glucose draw water into the urine, producing increasing urine output, and this is called a polyuria. So we can say the polyuria is the common symptom of diabetes mellitus because excess urine in the excess glucose in the urine causes osmotic diuresis. Now let's discuss about the question number 25. The prime question number 25. The primary priority intervention for a patient with an acute asthma attack is, the answer is maintain airway and administer prescribed bronchodilator. And the explanation is the priority is to assess and maintain the airway and breathing. The prescribe rapid acting bronchodilator such as a short acting beta 2 uh, agonist is commonly used for the acute bronchospasm. In an acute asthma attack, the priority is to assist the airway and breathing and administer the prescribed rapid acting bronchodilator. Now let's discuss about the 26th number. The classic sign of appendicitis is, that is right lower quadrant pain. Appendicitis often begin with the vagus or central abdominal pain and later localized to the right lower quadrant. Nausea, vomiting, and fever also occur. The classic presentation of appendicitis is that localized to the right lower quadrant pain. Now let's discuss about the question number 27. A patient with COPD is commonly advised to use, answer number A, purse lip breathing, which help patient with COPD control expiration and reduce ear trapping. Pursed lip breathing help in slow expiration and may reduce ear trapping, making breathing more effective for some patient with COPD. Now let's discuss about the question number 28. The main danger of several diarrhea is, the answer is dehydration. Diarrhea can cause loss of water and electrolyte. Severe dehydration can lead to hypovolemic and shock. if untreated. The main or major immediate danger of severe diarrhea is dehydration due to loss of water and electrolyte. Now let's discuss about the question number 29. Question number 29. The most common symptom of urinary tract infection is, the answer is dysuria. Dysuria means pain and burning during urination. It is the common symptom of lower urinary tract infection. Dysuria or painful or burning urination is the common symptom of urinary tract infection. Now let's discuss about the question number 30. 30. A patient with suspected stroke should be assessed immediately for answer number A. Airway, breathing and circulation. A stroke is an emergency. Initial management begin with the stabilizing of vital signs, especially airway, breathing, and circulation, followed by rapid neurological assessment and stroke specific care. And here the stroke or suspected stroke is an emergency, and the nurse first ensure airway, breathing, and circulation, and then perform rapid neurological assessment, which consists GCS. Now let's discuss about the question number 31. The antidote for heparin overdose is, here the answer is C. Naloxone. Prothymine sulfate can neutralize the anticoagulate effect of unfractionated heparin. It affects on low molecular weight. Heparin is only partial. Prothymine, I say the wrong answer. The right answer is the prothymine sulfate. The antidote for the heparin is the protamine sulfate. Protamine sulfate is the specific reversal. Protamine sulfate has the specific reversal agent for the unfractional heparin. Now let's discuss about the question number 32. The antidote for opioid overdose is, the answer is naloxone. I just mix up the heparin. Antidote for the heparin is the answer number B, and the antidote for the opioid overdose is the answer number B, naloxone. Naloxone is an opioid antagonist used to reverse the opioid induced respiratory depression. Now let's discuss about the question number 33. The antidote for benzodiazepine overdose is, answer number A, fulmazenil. It is a benzodiazepine receptor antagonist and can cause reverse benzodiazepine sedation in selected situation. It must be used carefully because it can cause also the seizure in some patient. Now let's discuss about the question number 34. The antidote commonly used for warfarin associated excessive anticoagulation is, that is vitamin K. Vitamin K is used to reverse excessive anticoagulation from warfarin in serious or life-threatening bleeding. Additional reversal treatment such as prothymine complex concentration may be required. Here the answer is the vitamin K, and it is used for the reverse excessive anticoagulation caused by the warfarin with additional therapy required in the severe bleeding. Now let's discuss about the 35. Which route provide 100% bioavailability? Here the answer is D, intravenous therapy. When the drug is administered intravenously, it enters directly to the systemic circulation. Therefore, the bioavailability is considered as 100%. In the intravenous administration, it is 100% bioavailability because the drug directly enter into the systematic circulation. Now let's discuss about the 36. Insulin is commonly administered by, the answer is subcutaneous route. The most routine insulin preparation is administered through the subcutaneous route because some specific insulin preparation may require I am sorry, I will explain it once more. Insulin is commonly administered by the subcutaneous route, but in some cases in emergency condition we can use also the intravenous route, but it is oral route is contraindicated in this the insulin. Now let's discuss about the 37 number. Paracetamol is primarily used as analgesic and antipyretic. Paracetamol is mainly used as an analgesic and antipyretic, which is commonly used to reduce the fever and pain. Now question number 38. A common adverse effect of morphine is, that is respiratory depression. Morphine is opioid, and opioid can cause the respiratory center in the brain to suppress. Therefore, respiratory rate and oxygenation must be monitored carefully while giving the morphine. Now let's discuss about the question number 39. Which medication is commonly used to treat anaphylactic reaction? Anaphylactic. That is answer number A, adrenaline. Anaphylaxis is a life-threatening allergic reaction. Intramuscular and intramuscular adrenaline is the mild at in the mild mid adrenolateral thigh is the first line treatment. Now let's discuss about the question number 40. In question number 14 we can discuss the before administering dioxin, the nurse should assist. The nurse should assist the apical pulse because this medicine can cause slow the heart rate and affect the cardiac conduction. The nurse should assess the patient pulse and follow the prescribed parameter before giving the administration. Now, the video goes long, so that we will end the session in here. Now, next question will be discussed in the another video, and please don't forget to like, share, subscribe the channel. Thank you.